Chapter 21 is over congenital and genetic disorders. The genetic information for each cell is stored on chromosomes. Humans have 23 pairs in each cell. 22 pairs are autosomes and they're numbered, and the 23rd pair is the sex chromosomes. Males have XY and females have XX. A karyotype is the arrangement of the chromosomes. You can see karyotypes on page 570 in the book. Figure A is a normal female and figure B is a normal male. Figures C and D are chromosomal defects. All cells in a person's body have the same chromosomes and genes for the same traits. This is called a genotype. So not all genes are active or expressed in each cell though. The phenotype is the expressed gene in each cell, or the physical appearance. So you can carry a gene, it might not be expressed, but it can be passed on to your children. This is how we get kids with genetic abnormalities when the parents don't appear to have the abnormality. Congenital disorders are present at birth. Inherited disorders can be caused by a single gene trait, meaning that the trait is controlled by one gene, or a chromosomal defect, meaning that something's wrong with the pair of chromosomes, or polygenic expression, meaning that it's caused by multiple genes. Single gene disorders are caused by a change in one gene in the reproductive cells that's transmitted throughout the generations. This table is on page 572 and it shows some examples of some genetic disorders and how they're inherited. Chromosomal anomalies are usually caused by an error during meiosis, so part of the chromosome doesn't transmit properly. It can duplicate or swap portions or reassemble incorrectly. A translocation is when there's an abnormal placement of part of the chromosome, and non-disjunction is the abnormal distribution of chromosomes, so either missing one or an extra. Some other congenital disorders, so teratogenic agents are agents that cause damage during embryonic or fetal development. This can be, different things from, chemicals or other substances, that cause problems during fetal development. And multifactorial disorders are large numbers of disorders that often have a pattern of familial inheritance. There could also be some sort of environmental component, but multifactorial really just means multiple factors, right? So there's lots of factors that play a part, or more than one factor that plays a part in this type of disorder. Some other congenital or developmental disorders result from premature birth or difficult labor and delivery, like cerebral palsy. So we'll talk about a couple genetic disorders. Single gene disorders are classified by inheritance patterns. They can be recessive or dominant or X-linked. They control a specific function like color blindness. They can also assist to some systemic effects like cystic fibrosis, Tay-Sachs disease, or PKU. Single gene disorders are sometimes asymptomatic. If there's a serious deficit, it usually does cause a miscarriage. Autosomal dominant disorders are when there's the presence of a defect on only one gene that produces expression of the disease. A parent with the disorder only has about 50% chance of passing it on to each child that they have. In this case, there aren't any carriers that don't express the disorder, so anyone that has the gene expresses the disorder. Some of these disorders are not diagnosed until later in life, like that adult polycystic kidney disease, Huntington's chorea, familial hypercholesterolemia, and Marfan syndrome. Autosomal recessive disorders are disorders where both parents have to pass on the defective gene to produce an affected child. Homozygous kids have both defective genes, and heterozygous kids have one defective gene and one normal gene. Heterozygous kids are carriers, but they don't have signs and symptoms. Male and female kids are affected equally here. And these include that cystic fibrosis, PKU, and then sickle cell anemia, as well as Tay-Sachs disease. Like we already talked about, autosomal dominant disorders, this is when there's the presence of the defect on only one gene that produces expression of that disease. A parent with a disorder has to have only has a 50% chance of passing it on to each child that they have. So in this case, there aren't any carriers that don't express the disorder. All people that have it or have the gene for it express the disorder. Some of these disorders, again, are not diagnosed until later in life. X-linked dominant disorders are when heterozygous, so one defective gene and one normal gene, males and females are affected. More boys than girls are affected here. Fragile X syndrome is an example. It's the most common genetic cause of cognitive deficits. The effects vary from person to person and the extent of the mutation of the gene. Social and behavioral problems are usually what you're going to see here. X-linked recessive disorders are carried by the X chromosome. You'll see signs and symptoms in males that don't have the matching unaffected gene on the Y chromosome. Female carriers without signs and symptoms, when they're heterozygous, again, one affected chromosome and one unaffected chromosome, females with two recessive genes can be affected. There's a whole bunch of Punnett squares on page 573, so you can see how all of this works out. Inheritance can look like it skips generations, but that's because people are passing it on to their kids who become carriers with no symptoms, and then pass it on to their kids who are affected. Some examples, I already said color blindness, but Duchenne's muscular dystrophy and hemophilia A. Chromosomal disorders are problems with the chromosomes. Probably the most common is Down syndrome. This is trisomy 21, so there are 3 chromosomes in the 21st position instead of the normal 2. It can be caused by non-disjunction or translocation. So again, a translocation is when there's an abnormal placement of part of the chromosome, and non-disjunction is the abnormal distribution of chromosomes, so either missing one or a duplicate. Turner syndrome XO or monosomy X happens when there's only one sex chromosome, the X, and this person is female. It causes infertility because there are no ovaries. Klinefelter syndrome or XXY or polysomy X is when there's an extra X chromosome. The person is male and might not have signs that are easily diagnosed, but they'll have small testes and they don't produce sperm, so they're also infertile. So further into detail on Down syndrome or trisomy 21, it's pretty common. It affects both physical and mental development. The risks of having a Down syndrome baby get higher as mom gets older. They do screening tests during pregnancy to check for Down syndrome. Some characteristics, I feel like we all kind of have an understanding of what the Down syndrome patient looks like. You can see some more pictures on 581. Some of the characteristics might not, jump right out at you, but that small head, round face, and the flat facial profile, slanted eyes, and the epicanthic fold are probably going to be what you recognize most often. They have a large tongue, a high arched palate, small hands with a single crease in the palm, a short stature. The muscles tend to be hypotonic and they have loose joints. They do have delayed developmental stages. Again, the severity is going to vary from person to person though. The cognitive impairment is going to range from mild to major. There'll be delayed or incomplete sexual development with these patients. The males will probably be infertile and the females have a lower rate of conception. Here's that facial picture that I feel like we all kind of recognize for Down syndrome. And some other pictures that you can see in, like I said, on page 581 in the book. Those multifactorial disorders, again, what I really want you to know is that it's just, different factors that combined with environmental issues, genetic factors combined with environmental factors that create issues in the patient. Examples would be a cleft lip and palate, congenital hip dislocation, congenital heart disease, type 2 diabetes. Developmental disorders involve exposure to environmental influences during pregnancy or even before pregnancy, like drugs, chemicals, alcohol, cigarette smoking, radiation. So this TORCH acronym, that's important to remember. It's an acronym for toxoplasmosis, other, which could be hepatitis B, mumps, rubiola, varicella, gonorrhea, syphilis. The R is for rubella, and C is for cytomegalovirus, and then H is for herpes. We use this during prenatal screenings for high-risk infections. Exposure to harmful influences in the first 2 weeks of embryonic life usually does result in death of the embryo or miscarriage. The first 2 months of development is the most critical, and exposure can impair organogenesis, which is the formation of important body structures. Here's some effects of the teratogens during pregnancy. You can see this on page 578. So to diagnose these different problems, testing could be available prior to conception or during the first trimester of pregnancy or in the newborn. Testing is recommended for people that have a family history of a specific disease, or if they previously have given birth to a child with an abnormality, or in different ethnic groups with high risk for specific diseases, or in pregnant women over 35 years of age. We can do blood tests in pregnant women called alpha-fetoprotein testing. We can do in utero testing, amniocentesis or chorionic villi assay, or neonatal testing for excreted metabolites like for PKU, or blood testing in the baby when the baby's born. Genetic engineering refers to manipulating genes. This is changing the DNA sequence by rearranging or deleting or eliminating or substituting. The goal here is to remove a defective gene and give a normal one to eliminate genetic defects. This is in testing phases. It's not something we do with humans yet, and obviously it's a huge topic of debate. We're not here to debate whether it's right or wrong or whatever. Just something to mention is it will probably become something available to humans in the future, maybe even in the near future. And then we have gene therapy. So this is a possible way to fix a genetic problem involving its source. It identifies the gene and protein responsible for the condition, and it determines how gene expression is controlled and produces a drug that will inhibit that gene expression. Research is focused on cancer growth, and it has resulted in these types of drugs. So again, these would be like gene therapy tailored to the specific patient to figure out what the genetic problem is and inhibit that gene expression. Screening at-risk populations for specific alleles is part of genetic screening and DNA testing. DNA testing is to identify individuals for paternity or forensic purposes. So legislation has been drafted in the United States to protect the genetic rights of individuals, and extensive research with artificial intelligence is ongoing to help in a rapid interpretation of genetic diseases in newborns.